Yo guys, Donovan here. In today's video, I'll be talking about anthrax. But yeah, anthrax is not a new disease in the market. Anthrax has been in existence for a long time. It can be traced back in the late 700 BC in the ancient Egypt, so the condition has been in existence for a long time. Anthrax is a zoonotic infection. That means it is an infection spread through animals. Examples of zoonotic infections are trypanosomiasis, rabies, anthrax itself, including tapeworm. So how can anthrax be defined? Anthrax can be defined as this is a zoonotic infection which affects the skin, the lungs, the gastrointestinal tract, and it is caused by a gram-positive, spore-forming and rod-shaped bacterium known as Bacillus Anthracis, and it is characterized by anesca, a papule, lymphadenitis, and hematochezia. There are three forms of anthrax. We have cutaneous anthrax, also known as skin anthrax. We have inhalation anthrax, also known as pulmonary anthrax, and we have gastrointestinal anthrax. I will explain all the forms of anthrax, but now let's talk about the predisposing factors. What can cause or risk you to have anthrax? Before we go any further, let me make this straight. Anthrax is not contagious. Anthrax does not spread from person to person. We meat lovers are at risk of having anthrax. Anthrax does not go through vegetables, so vegetarians are safe in this case. But you and I, meat lovers, well, let's watch out for the following. Handling infected animals, it's a risk. Handling infected animal products, it could be cheese, it could be meat, it could be wool. Inhaling anthrax spores from infected animal products, especially eating undercooked meat of an infected animal. These are some of the risks that can cause you and I, meat lovers, to have anthrax. Alright, so now let's talk about the forms of anthrax. There are three forms of anthrax. There's cutaneous anthrax, pulmonary anthrax, and gastrointestinal anthrax. So now let's talk about cutaneous anthrax. The route of entry for cutaneous anthrax is inoculation through the skin. So coming in contact with an infected animal or an infected animal product with your skin, well, you get to contract the infection. The incubation period for cutaneous anthrax is about 6 days to about a week. So an infected person will have clinical manifestations like a papule. So papule is an elevated lesion. Thereafter, this papule will become filled with fluids. Then we'll call it a vesicle. That will cause damage of the epithelium together with the basement membrane, causing an ulcer. So an ulcer will be formed from the damage of your epithelium and the basement membrane. The ulcer will begin to heal by granulation. Remember, there's going to be hyperpigmentation over the ulcer, causing it to look a bit darkish like coal, where we get the name anthrax because it resembles a coal. Alright, so the cutaneous anthrax is the most commonest form of anthrax, but the least deadliest form of anthrax. So this darkish spot you see on the skin, it's an ulcer by the way, but well, darkened. There's hyperpigmentation and healing by fibrosis, of course. That is an anesca, a diagnostic feature of cutaneous anthrax. So when you see that, get worried. You're advised to rush to the nearest healthy care facility. Now we talk about inhalation anthrax, also known as pulmonary anthrax. The route of entry is, well, inhalation, like you breathe in infected spores from an infected animal product. So that can precipitate you to have pulmonary anthrax. The incubation period, well, it goes to about 3 days, but can last for about, well, 2 months. So do not get tricked that you do not have anthrax from there. It has non-specific signs and symptoms. So a patient can present with non-specific fever. They can have a shortness of breath, a headache, abdominal pain, chills, including lymphadenitis. The Pulmonary anthrax is most deadly than cutaneous anthrax. Gastrointestinal anthrax, the rarest form of anthrax but deadly. Well, it causes ulcerations on the upper gastrointestinal tract and also affects your intestine. So you will present with hematochezia and hematemesis. There are two phases of clinical manifestations in gastrointestinal anthrax. There is a prodromal phase and there is a fulminant phase. In the prodromal phase, it's a phase with non-specific symptoms like fever, myalgia, which is muscle ache, and non-productive cough. Whereas fulminant phase has the rapid progression of fevers, massive edema, there's hemorrhage, stenitis, hypoxia, bacteremia, septicemia, including shock at the end of the day, and well, eventually will lead to one dying. Those were the three forms of anthrax. So do not underestimate anthrax. Anthrax can kill you. It is not something that you take lightly. So when you have one of those signs and symptoms I have just mentioned, please rush to your nearest healthcare facility for proper professional medical interventions. Anthrax produces three proteins known as the protective antigen, lethal factor, and edema factor. These proteins are very important for when combined, they produce toxins that are very harmful for the body because they destroy certain cells of the body. So the protective antigen combined with the lethal factor produces a toxin known as lethal toxin, and when the protective antigen is combined with edema factor, they produce what we call edema toxins. So these toxins are very important to understand for in our treatment. We are supposed to give antitoxins because anthrax produces exotoxins. Yeah, I got that right. All right. How do we medically treat anthrax? Well, for your exams, write your management followed by medical management. Put up your M's to identify the cause, treat the cause, and to prevent complications. Put up a heading which says investigations and diagnosis. So do your history, physical examination. Of course, there should be an appearance of an scar. If we are talking about cutaneous anthrax, do fluid swab for the vesicle for culture, biopsy for the scar. We can even do blood for microscopy. Well, if you do blood for microscopy, the characteristic feature of the Bacillus Anthracis, it will actually appear coma-shaped. Do not confuse it with the Vibrio cholerae, by the way. We can do full blood count, chest x-ray, vomitus or stool for culture, lumbar puncture. Well, for lumbar puncture, remember I talked about bacteremia? Yeah. So when the bacillus enters the bloodstream, it is transported all the way and reaches the blood-brain barrier. So it can affect the meninges, and anthrax can cause meningitis. Bacillus anthracis can actually cause one to have meningitis. So how do we treat it with medications? Since anthrax is a bacteria, we treat this condition with the help of antibiotics like ciprofloxacin, linezolid, and meropenem. So these medications are combined, like ciprofloxacin and linezolid are combined when there is no meningitis. When we have meningitis, we administer ciprofloxacin, linezolid, and meropenem. We can even add dexamethasone and other analgesia just to relieve the pain. We can administer bronchodilators if it is affecting the lungs and the patient cannot breathe properly, and then administer oxygen therapy. We can even give topical medication. This is in case of skin anthrax. So this is the best way we can talk about the treatment of anthrax. Remember, the best way to get treatment is to go to your nearest healthcare facility. This is not a platform to give you whole treatment. Alright, so this marks the end of our presentation on anthrax. To keep yourself safe, just ensure you stay away from unlicensed meat suppliers, for they can spread the infection because the meat products they are selling could be infected. So the farmers have to ensure that their cattle well treated and vaccinated against anthrax. By the way, there is a vaccination for anthrax, not for human beings but for the cattle. So when the animal products are vaccinated, we reduce the chances of having anthrax. That's why we are discouraging people from buying meat products from unlicensed meat suppliers. For the meantime, let's try to ensure that the meat is well cooked before consumption. Alright, thank you for watching Meat Courses. Please kindly follow, subscribe and like my channel and my page. Thank you so much.